right, let's connect to YouTube. Welcome, welcome, everybody. This is Clear Vision Wednesday. I'm your host, Claudia Mühlenweg. I'm a natural vision improvement expert. And this is the month of February. And for this month, we are focusing on an eye disease known as age-related macular degeneration. And I'm not the expert in this, but I did bring on an expert, or I have an expert right now who's ready to share information. Welcome, Dr. Rudrani Banik.
Thank you so much, Claudia. It's always a pleasure to chat with you and to share information that's so near and dear to my heart. I love this stuff. This is something I do day in, day out. So I love talking about it.
And that's why I'm so excited to have you on, because you are an integrative ophthalmologist. So you understand the traditional approach to, eye diseases and treatments. And you also are really on the forefront of working with diet and lifestyle and preventative, with a functional medicine background. So I'm so excited because we can see both sides and you have a lot of great information to share. So welcome, welcome.
Thank you.
So to begin, I think for some people watching here, we've heard of cataracts, we've heard of, maybe glaucoma, and we've heard of these things, but a lot of times we don't really know what that means. And I want to get started with just asking you, what is age-related macular degeneration? And is there also another form? Is it just age-related, or is what are we talking about here?
Yeah, that's a great question. So remember, the eye is a direct extension of the brain, right? So age-related macular degeneration is actually a neurodegenerative disease. When we think neurodegenerative, we think about Alzheimer's, Parkinson's, but actually AMD, or age-related macular degeneration, is the #1 neurodegenerative disease in the world. Like, it's estimated that this number is crazy. 200 million people around the world have AMD. And probably that's an underestimate, because a lot of people may not know that they have it, because the only way you're going to know in the early stages is to go and get it checked. In the earliest stages, it has no symptoms. So I can show you what AMD looks like. I'll just show you on the model, the eye model. So I'm sure you've used this before also. I know you have one. I've seen it. So if we look in the back, the eye is really complex, right? So there's over 40 different parts in the eye, but in the back of the eye, this area here that's represented by orange is the retina. And you see this yellow spot right here? This is supposed to represent the macula. Now, this spot is way too big. It's not normally that big. It's really, really tiny, but the macula is responsible for our central vision. Like, our 20/20 vision comes from here. So it's the area that gives us the highest resolution, highest contrast, and highest color saturation comes from the macula. Now, I can show you, let me just put that away for a second. I can show you, if you want, what it looks like in an actual human being, because I think it's helpful for people to see what we see. When we look in as an eye doctor, we dilate someone's eyes, we look in, what is it that we're actually looking at? So I'm going to share my screen and give you all a little glimpse into the back of the eye. So this is a picture of a human retina. And just to orient you, this is about only 10% of the retina. So remember, the eyeball is like a globe, it's a sphere. And when you look at the entire retina, you see a lot more. But here we're just looking at the central part of the retina. There's the optic nerve right here. I hope you can see my cursor. Can you see my cursor?
Yes, we can see that. Yes.
Okay, great. So this is the optic nerve right here. This is what connects the eye to the brain. These are the blood vessels going to the retina. And all this orange represents the retina. And the center part, this kind of darker area right here, this is the macula. Actually, the macula is this whole area in the center, but the centermost part of the macula is called the fovea. And this is, again, this is the area that's responsible for our 20/20 vision. So this is what a normal, healthy retina looks like. What happens in macular degeneration is that there are waste deposits that get deposited right into the center part of the retina. Remember, the retina has multiple zones. It's kind of like a bullseye. So I like to kind of think of it like this, like zone within zone within zone. So the bigger zone here is the macula, and then within that is the fovea, and at the very middle is something else called the foveola. Now, in macular degeneration, again, this is the normal on the left. This is a patient with early dry macular degeneration here. And you see these kind of like creamy whitish yellow dots. These are called drusen. And Claudia, I know you come from Germany, but I always love to say the drusen comes from the German word pebble or stone. So because they look like tiny little pebbles or stones in the back of the eye, but they're actually waste deposits. So waste deposits are not getting cleared. They get deposited under the retina. And when people have this early stage, often they have no symptoms at all. Like they have no idea they have it. It's totally asymptomatic. Then eventually, as the deposits start to increase, this is intermediate dry AMD. And here you can see there's a lot more of these tiny little drusen, these little pebble-like deposits, and you start to see some pigment changes. So in this stage, patients may start to have some symptoms, like they may notice that things are just not as bright. They may have loss of contrast. It may be harder for them to see in the dark. These are some common symptoms that people may have in this stage. And then people may progress to the next stage, which is advanced dry AMD. So there are two types of advanced dry AMD. There's dry and there's wet. And here, this is advanced dry, where there's a huge area where the drusen have kind of all come together and they've become like a large area of what we call atrophy. So basically the retina degenerates and there are no retinal cells in this area. So it kind of looks like a continent, like on a map. That's why they call it geographic. But GA or geographic atrophy is what this is. And you can see these are the blood vessels under the retina. So you have a huge chunk of retina that's missing. And when people get to this stage, because this represents the center part of your vision, people lose their central vision. So, they may find it hard, like a blotch in their vision. So they may find it hard to read, see faces, drive, use a device, etc. This is when it's really symptomatic. And many people, oftentimes, if they get to this stage, they may actually be legally blind by this stage. And this is what wet macular degeneration looks like. So what's happened is you can see a couple of the drusen over here, but because of all these waste deposits under the retina, then there is inflammation because of those waste deposits. And then the inflammation triggers these new blood vessels to form. And that you would think that blood vessels are good, but in this state, in this condition, they're not good. Actually, these blood vessels are not normal. They're not healthy, and they leak. They leak blood and fluid and protein. So this stage of wet macular degeneration, I like to call leaky eye syndrome. I know many people probably heard of leaky gut, leaky skin, but this is like a leaky eye syndrome where blood vessels are leaking out fluid and blood. And this is also when people lose their central vision, and they can actually go from seeing 20/20 to seeing 2200 or even worse very, very quickly, because this happens usually when it transitions from dry to wet, it goes very quickly, like it's almost like overnight. And so this is when people lose a lot of vision. The good news is that all these changes, like from going from early to intermediate to advanced, it doesn't happen overnight. It takes a long time for these changes to happen. So there's a window when people can do things to try to prevent it from progressing. And that's what I love teaching my patients about, like what are all the things you can do to prevent it from getting to this advanced stage. Sorry, that was a lot.
No, but I think it's really great to see those visuals. Obviously, it's always hard. I think I have an app which kind of simulates how your vision would look like when you have certain eye diseases. I think that I don't know what it was called, but it's always hard to kind of, because wherever you look, like if I look at you, if you want to stop your screen share, maybe.
Can I show one thing? Can I show one more slide since we're talking about what it looks like? So again, this is kind of like the progression, but this is what it would look like. So if you have, normal vision, you would see a clock. It looks, you can see all the numbers, you can see the hands on the clock. And if you have advanced macular degeneration, you start to miss the center part. It's like a blotch. It's like a smudge in your vision. So you really can't see the details. And, if you're looking at someone's face, this is what they see, which is really, it's so, debilitating to not to be able to see people's faces and not to be able to read. So I know it's kind of scary, but I thought it's important for people to realize, like, how does macular degeneration affect your vision? And this is, again, an advanced stage.
I think that is really helpful to see, because usually, we point our eyes at what we want to look. And so in order to see the clock, you have to look next to the clock, and that's where you don't have the sharpest vision. So it's, I had a friend actually, and it was one of the mom in the Waldorf school where my kids used to go to the school, and she had the juvenile, she had the, genetic form of macular she said she was driving for like 1 or 2 years before her driver's license was removed again because she wouldn't see the traffic light, what if it was, green or red. So it is really debilitating. And so before we get into like things people can do, I'm curious, like what are some of the, obviously the genetic, that was the example, she got it at 18 already or 19. So she was very young, and her son has it too, by the way. But what are some of the root causes? Like, why do we get this? Is it just we just get older, or is there things that we do that might have contributed to development of AMD?
That's a great question. So you're right. It's not just because we're getting older, because if you think about how many people are getting older above the age of 60, above the age of 70, there are only 200, I should say, only 200 million people in the world with AMD. So it's not just age, but it does increase with age. The prevalence increases. So what are some other root causes? And if you think about it from a functional medicine perspective, which, is something that I think is so important, just to try to get to the root cause. Don't just put a Band-Aid on the problem, but to address the root cause. So there are 3 root causes of macular degeneration from a functional medicine perspective. One is mitochondrial dysfunction. When our mitochondria in our cells, especially the mitochondria in the retina, are not healthy, they're not producing energy well, then that can lead to degeneration of the photoreceptors. Also, next is oxidative stress. And this is typically what happens not only to the retinal photoreceptors, but to the layer of cells underneath the photoreceptors, which is called the RPE, or retinal pigment epithelium. And these are the cells that basically eliminate waste products. And so if those cells aren't working properly because of oxidative stress and/or mitochondrial dysfunction, the waste products are going to accumulate. So they're like the garbage collectors for the retina. And actually, in reality, well, this is what I believe anyway, instead of calling it age-related macular degeneration, we should call it age-related RPE degeneration, because it's really those cells that are the problem that then affect the retina. So it's the RPE cells. And then the third root cause is inflammation. So from all of these waste products accumulating, you start to get inflammation. So there's a sequence of events that happen. Sometimes it's happening, at the same time, where you have oxidative stress and mitochondrial dysfunction, but inflammation is kind of a little bit further down the path. And all of these contribute. I mean, there's so many research articles published to show that, oh, this is happening, and this is happening, and this is happening at a cellular level. And it's a process that is not just related to age. It's related to perhaps, what nutrients are we having or missing in our diets that may be predisposing us to inflammation or oxidative stress. Also, what are the toxins we're exposing ourselves to in the world? How much light do we get in? Could sunlight be a factor? Other toxins in the air? Blue light, could that be a factor? That's a big question I know many people have these days. Also, other medical conditions. So many people don't realize this, but high blood pressure is a major risk factor for macular degeneration. Like it's like number one of the 5 top risk factors. And I've definitely had patients who have, they don't have good blood pressure control. They started off with early macular degeneration. They progressed very quickly because their blood pressures were like 180, 200 systolic, which is crazy to think that it would be that high, but they just weren't taking care of their blood pressure, and their macular degeneration progressed. So there's a lot to consider. It's not just, a couple of things. It's not just like a one-to-one association. You have to think of it like a whole, not just, your eyes by themselves, but what else is going on in your body as well.
I'm curious about glasses. We know that in Singapore now, the rates of myopia have absolutely skyrocketed. I think the youth is like over 90% of the youth in Singapore is now nearsighted. And they, because when you're nearsighted, where's my little rubber eyeball here, right? It's like your eyeball is elongated, and that puts all this additional pressure on the retina and the macula. So I read somewhere and let us know, like if you have really high rates, especially of myopia, that also increases the risk of AMD or other diseases. Is that true?
It's a great question. So with myopia, like you said, the retina changes. It becomes really, really thin because everything stretches out. And so people who have high myopia are at risk for something called myopic macular degeneration.
Okay.
So MMD. Yeah. So it's not necessarily age-related. And it's unfortunate because these young people with high myopia, they're at risk for a very similar type of vision loss, just not age-related. So, and they don't get the drusen, like they don't get those, pebble-like deposits. They actually get cracks in their retina, and then they get cracks in the retina because everything's so thin. And then the blood vessels come in through the cracks, and then they cause the bleeding. So the end result is the same, whether it's myopic degeneration or age-related macular degeneration, people lose their central vision. But yeah, there's actually significant increasing rates of myopic degeneration due to the high rates of myopia around the world. It's very, very unfortunate, but it's true.
I think nobody talks about this. So everybody listening here, right? Obviously, what kind of diopters in terms of strength of glasses are we talking about? Is it like above -5? Like, I mean, obviously the risk will, I'm assuming, would increase exponentially, but like, is there like, if you like a -1 or -2, is it you're like, nothing to worry about? Like, what are we thinking in terms of what increases the risk, what level?
So I don't know the studies, exactly if they have a specific number, but the way we think about myopia, we think about it like mild, moderate, severe. And mild is like anywhere -3 and below is considered mild myopia. And moderate is like -3 to -6. And anything more than -6 is high myopia. Definitely high myopia. Somebody who has, like, for example, -8, -9, -10, they are at significant risk for myopic degeneration. But honestly, I haven't seen people like -6 or below with myopic degeneration. So I think, you're probably protected. You're probably okay. But definitely, get your checkups annually and make sure your retina's healthy.
Okay, that's a great tip. And obviously improve your eyesight as much as you can. So I always say that I wanted to talk because most people just talk about AMD and not so much about myopic macular degeneration. I didn't even know that term existed. So I learned something here. Thank you so much.
You're welcome.
Okay, we covered, and I think mitochondria, I didn't understand until like maybe 3-4 years ago that the retinal cells have more, I always say the little batteries, right, in the cell. So so you talked about oxidative stress, inflammation, which is kind of the end state. You talked about mitochondrial dysfunction. I would love to ask you, like, first, like, what are traditional, like any, regular ophthalmologist that is not trained in functional medicine, like what would be the traditional approaches to, let's say you get diagnosed with drusen or you get diagnosed with the more advanced, what happens if you just go to your eye doctor, you get diagnosed with, let's say, dry AMD, like what is the traditional approach to that? And then I want to cover obviously what the preventative approach is on what you teach.
Yeah. So most eye doctors are taught, okay, if you see a patient with dry AMD, like early stage, you just watch them. It's crazy. Like, we don't do anything. Just, okay, we'll just monitor you. Come see me like once a year, once every 6 months. Sometimes some eye doctors will say, stop smoking because we know that that's a risk, or maybe eat some more leafy greens, maybe have some spinach or kale once in a while. And that's about it. If you get to an intermediate stage, which is, where you get lots of those little drusen, then your eye doctor will probably say, okay, if you're at intermediate stage now you qualify for the ARED supplements. And this is, many people have probably heard about the eye vitamins, like ARED supplements, which ARED stands for age-related eye disease study. So this was a study that looked at whether these supplements are going to help both macular degeneration and cataracts. Now, they found that it didn't help cataracts, but a certain combination of vitamins helped people, only a subset of people who had intermediate stage, prevent them from progressing to advanced stage. And it was only 28%. So you have to think about it like, okay, it's only for these people who already have advanced disease. They're going to progress. They're at high risk for losing their vision. It's only going to be protective by 28%. So there's something missing, right? Like it was very disappointing when the study came out, honestly. Like I was expecting a much higher percentage of protection that people would get, but it really wasn't that, I mean, people still take the vitamins. It's not that they shouldn't take them, but it wasn't as effective as we hoped that they would be. Okay, now the traditional approach, the next stage, if you get to wet or advanced dry, which is geographic atrophy, there are medications that are FDA approved, and these are injections into the back of the eye. Yes, I know. Everybody's like, most people, they cringe, right? Just think about a needle going into your eye. But I have to say, these medications have been around for a while. They're fairly safe. And they do work. They work to help prevent it from getting worse. But if you've already lost vision and you need these injections, you are not getting your vision back. It's very sad. Like I hate to say this, but it's true. You can't reverse that advanced stage back down to something like early or intermediate. It doesn't happen. But the medications can help people retain their eyesight. So yes, if you are at that stage and your eye doctor says, oh, you should consider getting these injections, I would do it. If it were me, I would do it because I don't want to lose more vision, with the understanding that I'm not going to get back what I've already lost. Now, these injections, they are done just to let people know. I don't know if anybody's had them before, but most people hopefully don't need them. But they're done in your doctor's office. They're done under local anesthesia. They're sterile. A tiny, tiny needle is used, and basically the injections. It's not just a one-time injection that people need if they have that stage of disease. They need to get these injections every month or every 6 weeks, usually. And there are some medications that can be given every 3 months. But basically, you're seeing your eye doctor like once a month for forever. Because once the doctor starts injecting, I asked one of my colleagues once, like, have you ever had any patients where you stopped injecting them? Like once you started the treatment, they're like, no, we just have them keep coming back. I'm like, why? Like, isn't there an endpoint to this treatment? And they're like, well, maybe if they become like totally, there's no more bleeding, et cetera, maybe we can consider it. But ultimately, we just keep having them come back. If it's not every month, every 6 weeks, or every 3 months. It's a lot. It's a lot because people, when they go, a lot of patients who need these injections, they're older, so they can't dry themselves, first of all, because their vision is not good. They need to get somebody to take them. It's like a whole, half a day affair or day affair. So they're, having to go and take a, friend or family member. It's a huge commitment to get these injections. So it's not easy on patients. It's really a challenging treatment to commit to.
Well, thank you for. So I think we also want to paint this picture that this is, guys, no fun, and that it's really important because when we're younger, like, oh, it's okay, I don't know about you, Rani, but sometimes I get asked, why do you eat so healthy? Like, I don't want to sacrifice. And I think a lot
Exactly.
of people don't think about this stuff. And then later, right, like you said, there is, and I worked with clients who just said they don't want to get the shots anymore. And then they understood that, the potential risk of, but
Mhm.
yeah, it's not something to take lightly. But let's switch to the more positive angle. So especially when you have the early stage, right? The more advanced something is, correct me if I'm wrong, like at that point, the chance of reversing anything is, and
It's
it's
very
not like
slim. I'm
cataract,
not going
right?
to say it's impossible, but it's really, really slim.
Yeah. And with cataracts, there's lens replacement surgery, which is also not to be taken lightly, but at least it's a way to quote unquote fix,
Mhm.
your cloudy lens. But with AMD, that is really, like Dr. Rani just said, that is really, once it's advanced, it's shots in the eye. So let's talk about, first of all, I would love to talk about what people can do to prevent this, right? To keep their eyes in optimal health. And then also, if you have seen any of those holistic approaches, see like what can people expect, what kind of outcome can people expect. So let's talk about first what do you recommend to prevent this.
Okay, well, number one, number two, and number three, nutrition. Nutrition, nutrition, nutrition. So we know that there are the eye health vitamins, right? The macular carotenoids, lutein, zeaxanthin, and mesozeaxanthin. And these are nutrients our bodies can't mix. We need to get them from foods or from supplements. But basically, these are our natural protectors in our eyes. These are very powerful antioxidants. So when we eat foods that provide these, they get absorbed, they get deposited into the back of the eye, into the macula, and they serve as our natural, not only antioxidants, but they're like our natural sunglasses, our natural blue blockers. So you need to eat foods that are rich in these nutrients. And there are many, many studies that show that if you have a diet that's rich in these nutrients, you can reduce your risk of progression of macular degeneration by 40%. Okay, 40% reduced risk versus with the vitamins, only 28%, right? So, more people need to be talking about this. I'm really this is kind of my mission now, is to educate my colleagues so that they can go tell their patients, like, eat more fruits and vegetables. And so studies have shown like if you have like 3 to 5 servings of fruits and vegetables a day, and specific ones, that you can reduce your risk. And so which foods are highest in these macular carotenoids? Well, we always love to talk about like the green leafy vegetables. So they're super high. So if I had to choose one above any other, it would be kale. I know some people are a little bit cautious about kale because of oxalates, but kale would be number one. If you can't have kale, then there's lots of other options. Spinach is number two, by the way, but also any kind of greens like collard greens, Swiss chard, mustard greens, dandelion greens, bok choy, broccoli, like all of those will have
I love arugula.
arugula, yes, arugula, romaine lettuce, like all of that will provide you with lutein and zeaxanthin. Also, so let's talk about some of the foods that are not leafy greens. Like what else can you eat? So eggs. The yellow of the egg, the yolk, that beautiful like orange yellow color is because of lutein and zeaxanthin. So it's a great source of these nutrients. Also, a lot of if you think about other vegetables and fruits that are yellow or orange in color, like orange bell peppers, yellow bell peppers, great sources. Corn, non-GMO corn, of course, but corn is a great source of lutein and zeaxanthin. And then there are some spices, like for example, paprika is a spice that I love, and it's actually a ground up pepper, and so it's really rich in both lutein and zeaxanthin. So again, if you're not a big fan of leafy greens, that's okay. There's other options for you. Now, the third nutrient, which is mesozeaxanthin, there's again lutein, zeaxanthin, mesozeaxanthin. Meso is right at the very center of the retina. So at the foveola is where meso is located, like right in the center of the bullseye. Now, unfortunately, there aren't many foods that provide mesozeaxanthin. There's only like a couple of fish. You can get meso from their skin. Like if you eat the skin of the fish, you can get some, but it's just not enough. So what we think is a lot of the mesozeaxanthin comes from lutein. So the body converts lutein into mesozeaxanthin, or you could take a supplement. So there's different ways to do it.
Can I interject? I have a couple of questions. I have a couple of questions. So is it true that with eggs, I personally don't eat them, but is it true they have to be raw egg yolks, or does it matter if they're cooked or raw?
Cooked is fine. Okay. Yeah, I would actually recommend cooked just to be careful so you don't end up with an infection.
What about you talked about fish? Like I'm personally plant-based and just so the mesozeaxanthin, can we get that from algae too, or is it only in the skin of the fish or produced from our own?
Yeah, I've looked into it, and I'm actually mainly plant-based as well. I'm vegetarian and mainly plant-based, but sometimes I have some animal products. As far as I know, you can't get it from algae. There's something else you can get from algae, which we can talk about, but the meso is really, really hard to find in nature. Okay. It's really not readily available in nature, but it is the most important
question. The obvious question, what about carrots?
Well, if you read my book, Beyond Carrots, carrots don't actually have lutein or very little, like if I won't say none, but very, very little lutein and zeaxanthin. They have beta carotene, which is like a cousin to lutein zeaxanthin. And yes, beta carotene is important for vision and for our retina and for our cornea, but not as much bang for your buck with carrots. So
how did this whole thing, like, how did this myth get, I don't know, but the whole carrot thing, I mean, everybody you talk to like, oh, I know I should eat carrots. This is like,
you know where it came from? Do you know where it came from?
No.
Oh, okay, I can share. It's actually an interesting story. So this goes back to World War II. And so in England, they were getting bombed by the German fighter jets. And the German jets would come in at nighttime and bomb, drop their bombs. And so the British, they somehow were able to detect those jets and then shoot them down. So everybody was wondering, like, how do the British pilots, like, how do they have such good eyesight that they can see in the dark and shoot down these bomber jets? So they started spreading this myth that, oh, our pilots are eating carrots and carrots are giving them great night vision, and that's how they're shooting down the jets. In reality, the British had developed radar technology, and this was like brand new back then, like high tech, this is back, 1940s. So they had radar, and that's how they can detect the planes, and that's how they could shoot them down. But they spread the myth about the carrots. So everybody started eating carrots. The entire world started eating carrots, especially the German pilots. I don't know if it really helped them, but then there was a carrot surplus. And so all these, farmers had all this extra carrots, and they made all kinds of carrot stuff, like carrot soup, carrot bread,
So it was a marketing campaign.
cookies.
We had all these extra carrots, like what can we do? And they do have beta carotenes, which is good for night vision. We know that, right? But that is such a funny
Yeah,
story.
so I call it like it's a partial myth. It's not a total myth, but it's like
Right,
a
right.
partial urban myth. That's not why they were able to see in the dark. No.
Yeah. But I mean, they do, the beta carotenes do help with night vision, of rod cells and all that stuff. But yeah, it's I have not heard that story. That is so interesting. Okay, so let's what you wanted to share more, obviously. So we talked a lot about the some of the eye vitamins, or the nutrients, not vitamins, but the nutrients. What else?
So in addition to that, the omegas are really important. So DHA, EPA, the highest concentration of DHA is actually in the retinal photoreceptor. So you want to support their structure and make sure you have enough DHA. So you can do, if you eat fish, you can do fish like at least 3 times a week. Fish like salmon and trout and mackerel and sardines have a good amount of DHA. If you don't eat fish, then you can do a supplement, or you can get your omegas from certain seeds, like, for example, chia seeds, flax seeds, hemp seeds. They're also good sources of omega-3s. However, they have to, the omega-3 in seeds is called ALA, alpha-linolenic acid, so it has to be converted by the body into DHA and EPA. So there's a couple of steps there, and not everybody can convert it well. So if you happen to be vegetarian, plant-based, then I would suggest taking an omega supplement, like an algal omega supplement, to make sure you're getting enough. And
Yeah,
then also
I one, and I'm in testing, right? Like I realized I need to retest myself because I started taking a new one, and because how do we know otherwise, right? We don't really know what we can eat all these things. We don't know if you're converting or not. So, right, is that something that you also do with your patients, that you get them?
Yeah, so there's a test. I don't know which one you did, but Omega Quant is kind of my go-to test for, to see what the ratio is between omega-6, which are typically like the pro-inflammatory omegas, versus omega-3s, which are the anti-inflammatory omegas. So you can do, it's like a finger prick, and then you just, put a drop of blood and then you send it in. So it's pretty simple to do. What else? So astaxanthin is another nutrient that's kind of like up and coming when it comes to macular degeneration. So there's one study out of Italy that showed that astaxanthin in conjunction with the other 3 macular carotenoids was really helpful. Astaxanthin comes from algae, like red algae. And so you can take like an astaxanthin supplement. Again, it's not easy to get through diet alone because you'd have to eat a lot of marine animals like fish and shellfish, etc. Basically, anything that's pink will have astaxanthin in it, but the preference is just to take a supplement with astaxanthin in it. And then, of course, for mitochondrial function, you need all your B vitamins. So make sure your diet's got, a wide range of whole grains to provide you with your B vitamins. There's also other fruits and vegetables that provide B vitamins. So there's a lot of places or a lot of sources you can get your Bs from. And then, the other big class is bioflavonoids. I don't know if you're familiar with bioflavonoids, but they're plant-based compounds, and they protect the plant from disease, like they protect it from infection or from oxidative stress. So when we eat these bioflavonoids from plants, our bodies get those benefits also. And if I had to choose for macular degeneration, there's over 4,000 bioflavonoids in nature, but if I had to choose one group, I would choose the anthocyanins. And anthocyanins come from berries. They give berries their beautiful colors, particularly like the darker berries, like blueberries, blackberries, bilberries, mackey berries. And so these anthocyanins are very protective for the retina. And so there are studies to show this also. Mainly animal studies or basic, like in vitro studies, but there are some human studies as well. So I talk to all my patients about this, like, what are you eating? how can we boost that? How, what else can you do from in terms of a dietary approach? And also, what should you not eat? This is also just as important.
Exactly, and I want to ask you about that. But I heard that goji berries are also good. Goji berries, then
Any
you
kind
know
of
they come
berry
with,
is good, but goji
yeah,
berries are, those small reddish berries. They're kind of
right.
chewy and they are so nutrient dense. They are
They're
amazing.
so yummy.
Um,
They sell them at Costco, and there's the dried ones, and I just
they're so
um
good. They're
I have an
delicious.
interesting question too. Sorry, I didn't mean to interrupt, but David Sinclair on this podcast talked about that plants that went through stress, right? Because you just talked about the bioflavonoid and how they help protect the plant, right, from like diseases and all kinds of things. And plants, and I would think an organic plant maybe had to go through a little bit more stress in their life, to kind of fight off those things versus. So he said that apparently, and I don't remember all the details, maybe you do, but that gives us even more benefit in terms of, so sometimes my little veggies in the garden, I don't water them. You guys have to have some stress so that you give me more benefits.
That's I love that. That's so it's an interesting theory. I don't know if it can be proven, but yeah, I mean, the more the plant is stressed, the more that it's going to try to protect itself. So
Right.
maybe it's increase the concentration of its own protective mechanisms.
That's
Hmm.
what I was thinking. I think that was the thing. Okay, so now let's talk about, we have a little bit more time. We also have some questions that I want to make sure we go through. But what are things not to do? You talked about smoking already, but what are other things that, a big no-no?
Yeah, I wanted to share one thing about smoking. So there was one study that looked at twins, identical twins. And so one twin smoked and the other twin did not smoke. And the twin who smoked had a 2.5 times increased risk of wet macular degeneration. So it's a big, big risk factor. And so that also includes secondhand smoke. I always tell my patients, like, if it's possible to try to avoid secondhand smoke, if you can't necessarily avoid it, let's say you have a family member or someone, a neighbor who's smoking, make sure you have a really good air purifier in your home, or especially by your inner bedroom, by your bed, because there's other studies from England that show that air pollution is also a risk for macular degeneration. So, especially if you live in like a urban environment, get an air purifier in your home. It's really, really important. Other risks. So we know that body weight plays a role, and people who have increased body mass index or BMI are more at risk. So if you are a little bit overweight, consider losing some weight, and that's so many health benefits from that. Lack of exercise is another major risk factor. So there was a large study looking at women, some of whom really had no exercise, and others who had mild exercise, and others who had moderate activity in their lives. And they found that even the people who did mild exercise, maybe like 2 or 3 hours a week, had decreased risk, and people who did moderate exercise had even more benefits. So I know exercise is kind of like, for some people, it can be a little bit overwhelming to think about, like, I can't do it, but I say just try to get movement into your day. Like, if it's not, even if you can't like do something cardiovascular, it's okay. You do what you feel comfortable with. At least move a little bit, maybe walk around a little bit, do some deep breaths, do some chair yoga, whatever you can do to get your body moving is going to be helpful.
I love that. I recently watched the Blue Zones documentary by Dan Bittner on Netflix, and Okinawa, all these people in all these blue zones, they move a lot. They don't actually like exercise, like go to the gym, but they move like the whole day. They walk down the steps in Sicily, and
Mhm.
the little, so they get that exercise. They squat. They just do a lot of movement all day long, ride horses, whatever they do. And these are all 100-year-old people where you're like, so that you're absolutely right. I think what we just think of exercise and we have to go to the gym or have to do, but moving alone, just moving more. And, I work from home now. So for me, that's definitely something on my very important, not urgent quadrant where, it's easy to just push it to the side, but really finding time to move. So thank you. That's a great one. So
And
what else
also,
is,
you were saying like where a lot of us are working from home, or maybe you're on a screen all day and you're sitting. So simply standing up, not being sedentary, maybe get a standing desk. That can even be helpful. I can see you. I know. Yeah, exactly. That can, because then while you're working, you can still at least move around a little bit. And at least there's better, circulation if you move a little bit, and so, or do some stretches. So there's a lot you can do. Don't get intimidated by exercise.
So I just want to cover, so I want to, anything else that, we know sugar, alcohol, and then any specifics you want to say about that? And we talked a little bit about blue light in the beginning.
There's a really interesting study that was done, I think like in the early 1990s. They look at diet, and what they found was that people who had the SAD diet, basically like a standard American diet, refined sugars, unhealthy omega-6 fats, and processed foods, they had a much higher risk of progression to wet macular degeneration. So stay away from sad foods. Try to eat whole grains, not processed sugars. Try to eat, more omega-3s in your diet, and then more fresh foods rather than processed foods.
Okay, that although good old advice, like the original food, like, and you talked about plant-based, and I think plant-based is a term that's thrown around now a lot, and sometimes originally meant you're purely vegan. But to me, it's like, what is the foundation of your diet, right? Even if you add some servings of fish or whatever, or an egg here or there, but really the foundation should be, all the colors of the rainbow, everything you talked about. So we do have some. Is there anything else that you want to say that we have not? We talked about
one comment about the plant-based. So many of my patients, they don't want to explore a plant-based way of life. So I use a different term. I tell them, make it plant-rich. Okay, so eat plant-rich. And yes, you can still have, meat or whatever else is, fish, eggs, whatever. Make it plant-rich. Make sure you get your plants first, and then you can eat whatever else you want.
Love that. Love that. So two more things, alcohol and blue light. I think we kind of out of time, and I want to make sure we have time for questions. Alcohol, we often hear, oh, the grapes, they have that's so high in the, what was it now? Not the bioflavonoids. Yeah, resveratrol and all those things. But then alcohol is not necessarily.
Alcohol, there's new studies showing that it can cause brain issues like cognitive decline. Even, we used to think like 1 or 2 glasses of wine is okay, but now studies are showing that even that can sometimes be detrimental. So I would say rather than to have wine or, eat, have wine for that benefit, eat the grapes themselves.
Exactly. What about blue light? So that's a big, we can do probably a whole episode on this. And I do recommend sunlight, but there's always too much of a good thing is bad too. So, but what about blue light in general from computers?
Blue light, fortunately, all the, the light we're getting from our screens, from our bulbs, etc., also from the sun, there is no proof that too much blue light exposure triggers worsening of macular degeneration, which is a good thing because we're on screens all the time, all of us. And so if that were the case, we'd have an epidemic of macular degeneration. So luckily, it doesn't cause long-term side effects, but it can cause short-term side effects like sleep issues, etc. So that's what I'll say about that. But we could do a whole episode on blue light because that's another favorite topic of mine.
I would love that because that whole I had Rudy Nasi from Viva Rays, and we talk about how to make the junk light more full spectrum. He has wonderful glasses, but then not because we don't want to block the blue light during the day. Otherwise, I would always say we're just going to be cuddling and sleeping in all day. But so that whole blue blocker industry, again, that's like the carrots, right? There's probably somehow there was this huge alarm about, and again, you talk about there is sleep issues, when people get blue light exposure in the evening, you can't sleep. But that whole idea that it's destroying our eyes, it's just the marketing.
No, that is a total myth. And again, we would be all blind right now if that were really true.
Okay, let me just look at YouTube really quick if there's any what questions there are. So let's see. I just want to. So there was but the question about myopic macular degeneration, is that another whole topic? Really, at the end of the day, right? It's very similar, right? Or would you say that it's very
similar?
different?
It's just that it can happen in younger people. That's the difference. Like I've seen people who are in their 30s, 40s with vision loss from it. And it tends to be more asymmetric. So like one eye and the other eye may be fine. Versus macular degeneration it can be asymmetric, but tends to be more symmetric.
Okay, so here's V. Perez said, can you comment on using light therapy as promoted by Dr. Jacob Lieberman, an ophthalmologist? He was actually an optometrist who used light therapy to heal his mother's eyesight and wrote light medicine of the future. So What are your thoughts on, I mean, light therapy alone is like a whole nother topic for another hour, but just really quickly, what are your thoughts on light?
So in the eye care world in ophthalmology, we call it photobiomodulation. So using select wavelengths of light to try to turn on certain pathways to help cells live longer. And so the most work has been done with red light, 670 nanometers, and infrared light, which is, I think it's about 860 nanometers. But there's also some evidence that shows that light 590 is also potentially beneficial. So that's more like greenish. I think we're going to learn more about this, and I actually do recommend it for my patients to do photobiomodulation. You can use like a bulb, or you can use a panel. There isn't anything to date that's, commercially available specific for eyes, but there probably will be in the near future.
Yeah, I have an infrared panel myself. I usually just say the natural light has all these wavelengths, and so I just get some natural light. But it's great if you get up before, the sun comes up, and just to help. I think the studies were done that it helps rejuvenate the mitochondria. So there's a couple more quickies here. Yeah, somebody just asked if infrared light is bad or good for your eyes. So you clearly answered that. How often should we get checked for AMD? Like, how often should we see? I guess that also depends on your age, but generally speaking, what would you recommend?
So it's recommended that if you're over 40, you should go see your eye doctor at least every 1 to 2 years. And if they see anything, then they may have you come back more often. Some patients go once a year, some people go every 6 months, some people have to go every 3 months. If they have early macular degeneration, then they may need to be followed more closely.
Okay, and then this is also a good question. Do you look at the red light, like the light with eyes open or eyes closed?
Eyes closed, please, with your eyes closed. So that light can still get through your eyelids and have the benefits. So don't look directly at the light.
I do that sometimes, I have to admit. So far, everything is good, but I also blink and I don't do it for long. Anyway, so eyes closed is the recommendation here. And then one last question, like two more. One person wants to know how much astaxanthin per day. You should really talk to your healthcare provider, right? We cannot just throw out random, or is there any exact numbers given in the studies that you need to take?
The studies range anywhere from 2 to 12 milligrams.
Okay.
It's a broad range. 2 to 12.
Wow.
Yeah, there's a big range.
And then last question, what about saffron for macular health?
Yeah, so in my book, I talk about saffron also. So saffron has bioflavonoids, crocin and crocitin, that's what they're called. And they're also very potent antioxidants. And saffron's a little expensive, so you can maybe splurge once in a while, include it in, maybe your tea or soups, etc. But it does add a wonderful taste to food. So
I love your book. So I want you to just give a couple more minutes, but I love how you have, onions here, right? And you have it listed eye benefits: C for cornea, L for lens, O for optic nerve, and then R for retina. So I love how you kind of talk about what are the most powerful foods, and then you have beautiful recipes here at the end. And right, there's some recipes in the book, and there's all the things. So maybe share a little bit more about this book that just came out, like a few months ago, right? Beyond Carrots.
It came out last year, like April of last year, and
okay.
Yeah, and so it's all about there's different chapters. The first chapter explains about how the eye works and what the nutrients are that we need for the eye. So it's not just carrots and beta carotene. We need over 30 nutrients to keep our eyes healthy. And there are at least 40 different foods that provide those nutrients. So then I talk about what all the foods are, and I go through the entire alphabet. So A to Z, all the different foods that can help us support our eyes. And then I have the recipes also.
And we put all these things in the show notes. I will put the link into the YouTube for the book. We will put everything is underneath the video. So you can find your website. I think you're on Instagram. You have eye vitamins and, anything else you want to add. This was so wonderful and interesting.
Yeah, I feel like Claudia, we talked about so much, but I feel like we just like are, skimming the surface. Like there's so much else I would love to share.
Well,
But
you
I do
can
have
come
a
back.
book coming out on macular degeneration. So this was my first book. I have a cookbook also that goes along with it, but I have a new book coming out hopefully later this year, and it'll be called Beyond Leafy Greens because we all think leafy greens are like the key to our retinal health, but there's so much more we can do. And in the book, I'll talk about all the integrative strategies that I use for my patients and how to do them. So if you wanted to explore those options.
Wonderful, wonderful. This was really amazing. I'm happy to have you back. Every quarter we can kind of do a, topic because there's so
Mhm.
much that obviously as an ophthalmologist, and I always recommend ophthalmologists to my clients too, because you do want to get your eye health really checked. And you're not so much about the glasses and all those things. You're really focusing on the eye health and giving your patients strategies to prevent all those things that many eye doctors think are just like there's nothing you can do. It's just everybody gets it, right? So
Yeah.
um,
Yeah, there's
thank
so
you.
much you can do. So don't give up hope. And no matter what your eye doctor says, keep searching for solutions.
I absolutely love that. So we definitely need more of you. I hope you can train more people, more other of your colleagues into this, so that more people in the world get the support they really need for their eyes, which is so precious. So thank you so much. Goodbye, YouTube, and we will see you next week. Thank you, Dr. Rani.
Thank you.